guys, this is my beautiful patient, and we're just gonna wait for a few people to join. Today we're gonna be discussing a few of the misconceptions regarding dark skin and facial sculpting. So a lot of patients, they don't understand, or they think that because you are dark skin, you do not age. And so, in certain aspects it is true because of our skin complexion. The beautiful melanin protects us from the sun. But on the level of the bone and the fat pad, across all age, across all skin colors, whether you are Caucasian or you Indian or you are black, you're going to age the same. So my patient here today is basically coming in for her frown line. So I want you to frown. So we are going to get rid of that. Now this is a muscle here, right? You have the muscle that runs all the way down like this, and then you have a muscle here. So we have to inject one center to get this muscle, and this muscle here you can see pulls it down. So by relaxing this, she won't have the downward movement. And then we have this area here that we do a bit of toxin. Those are your corrugator muscles that pull your brow together. So if you're wondering why there is 5 injections, it's because there's different parts to the frown we have to inject. So we inject 1, 2, 3, 4, 5, right? So she can't pull the frown together, and she won't be able to pull the brow down, right? So we call her back in 2 weeks and to basically check if she's happy, and she'd have a beautiful elevation to her brow, and it will be slightly further apart, and she's preventing. The other complaint was she wants to improve these lines, and this is from the nose to the mouth, so nasal labial fold. So she wants to improve this, and the reason why this occurs is because your cheekbone, your angle decreases, as well as your maxillary bone decreases as well. And then you get your temporal area, there's a bit of a concavity that's occurring in this. So I'm going to ask my therapist to go bring my flip chart, the one where it has 40, 30, 40, and 50, so we can show the viewers what I'm actually talking about. Just bring it in quickly. So usually when I discuss this with my patients, I show them, I have a nice flip chart, I have my skull. So I think my skull is here. Oh, my therapists are being very proactive. I think they took it back to the room. Just bring my skull also. So this is what I was talking about. So at the age of 30, we should only be complaining about just dark circles, right? Because the fat pad, which is your deep fat pad sitting over the bone here, starts to deflate. But as we get to mid-30s and entering to our 40s, can you see the bone changes that are occurring? So I just want you to hold this. Yeah. So you'll find that with this skull here, I'm going to just place this on you. This area, this aperture becomes much wider. If you look from 30 to 40. So what's going to happen if this aperture becomes wider? Your brow's going to drop. There's going to be less support to the eye area inferiorly and superiorly. So whether you are dark skin, light skin, bone is going to decrease the same amongst all of us. It's just the skin, you don't get that sun damage as you would if you were light skin because we have melanin. So moving from here to here, you'll see there's this concavity in the temporal area. So in your 40s, you start complaining about low brows. You start complaining about under eye circles, and you also start to complain about nasolabial folds because there's a deflation of that bone. Here, you shouldn't necessarily start picking on jowls or mentioning double chin because your jaw does decrease, but not as much. When you get to your 50s, if you have not started treating the temporal area, your cheekbone area, the medial aspects of your cheek, you are going to suffer with jowling, double chin, nasolabial fold. So there is 16 points in the face that we have to treat. So that's why we tell our patients, start the process early. As soon as you see that you are having dark circles, start correcting cheek, because that's what we're doing with our patient now. We're starting early, we're getting her structure corrected. And once we get her structure corrected, she'll only need 1 or 2 vials. The next time we'll need to top up, maybe it will be in a year and a half, 2 years' time, where we'll look at her skin and we'll say, okay, let's see if we might need to do a little bit extra here, or let's see if we need to improve the jawline. But don't wait till you have 3 or 4 areas to treat, because the way the skin or the face works, it's a domino effect. If one area collapses, it's going to collapse multiple areas. So if you start getting a double chin, it's because of 10 other areas that have collapsed. If we look at the fat pad, yeah. When you're younger, above the bone sits a lovely fat pad. These fat pads in your 30s are nice and compressed and compact, but the deep fat pad, the deep medial cheek fat pad, starts to decrease at the age of 30. So at 33, 34, 35, you'll start to see just the middle part of your tear trough showing. Not a full tear trough, just the medial aspect. And you'll start to see it at 40 when you start to get these fat pads disintegrating. At 50, that's what we have to do. So when you have fat pad, deep fat pad resorption, or it disintegrates, as well as the bone change, you need filler to replace the anatomy. So it doesn't mean if you're dark skin, you don't need filler, you don't need Botox. It just means that you need to watch out for facial changes. And I'm so glad my patient is starting young. That's the first thing I said to her. She's ahead of the game, because if she starts now, she's going to have a much better result. She's going to look more natural. We'll be able to get her back to her anatomy early and not start when she is 50, because that's where the problem is. The problem is when you start too late, you start looking less natural. Prevention is the best part. Going back to your anatomy is where we want to be. So cheek is the first point, medial cheek, second point, third point, temporal area. This area here is where all the elevators to the lower part. When I say elevators, it lifts the lower part of your face. If you sculpt this area, take the anatomy back, the bone structure back, you will not get jowls. You will not get nasolabial. So if nasolabial folds are starting to form, that means your angle of your cheek has decreased, the elevation has decreased, and you're sitting somewhere here. So you could be born with a bone structure like this, but you could be 25 years old. So that's where we try and take you back to the normal anatomy. So it's all about bone structure. That's when you use filler. If you start getting these nasolabial fat pads and the jowls, we have to pick this up. So we improve the structure with filler. we pick up the fat pads with threads and we treat the skin with Botox. Boop. That's what we treat it with because we're getting rid of wrinkles. We also treat the skin with Dermapen. So these are all the things we do to improve your skin, your bone, your fat pad. It's all about anatomy. It's all about getting you back to normal. So I hope that was, interesting. I hope that was removed any kind of stigma attached to filler and Botox. Remember, anatomy. If you go back to anatomy, you look natural. Don't ask for big lips. Big lips on a different anatomy, it looks crazy. I get a lot of patients asking for trends. Trends, it's not, anatomy restoration is a trend that is never going to go out of fashion. And that's what your face has to be. It needs to be timeless. It's not about 2021 having, what is that, fox brow and I don't know what nonsense. But please save the video, Dr. Emily. Yes, I will. I know I suck at doing that. I will definitely save this video and put it on IGTV. So it will be there for you guys. And also during your consult, I do a full facial sculpting consult. So remember, don't follow trends. Follow anatomy. Anatomy is the best part. Okay, so this is just showing you how your face is going to age. And now I'm going to get back to my patient. We're going to do a vial of filler just here. And we're going to do her Botox. So she's basically not going to age as fast as all of us. I mean, because I didn't start filler until much later. So you are doing good. Okay, so I'm going to go. Bye, guys. I will save the video, Emily. Bye.